How does quetiapine affect elderly patients long-term? Have you ever wondered how medications like quetiapine impact elderly patients over time? Quetiapine is an antipsychotic medication often prescribed for schizophrenia and other psychotic disorders. Its long-term effects on older adults are important to understand, especially since this group often faces unique health challenges. Quetiapine works by influencing neurotransmitters in the brain, mainly serotonin and dopamine. These chemicals play key roles in mood regulation and managing psychotic symptoms. However, elderly patients may have additional health concerns, such as dementia or heart issues, which can affect how they metabolize and tolerate medications. When it comes to long-term effects, elderly patients taking quetiapine often experience common side effects. Drowsiness, dizziness, and low blood pressure upon standing are frequently reported. While these effects are usually manageable, they can increase the risk of falls, which is a significant concern for older adults. Cognitive impairment is another area of concern. Some studies suggest that quetiapine may lead to cognitive issues, particularly in elderly patients with Parkinson's disease. However, this effect is less pronounced in those with dementia. There is also a general warning regarding increased mortality risk associated with antipsychotics in elderly patients. Fortunately, quetiapine appears to have a lower risk of cardiovascular events compared to other antipsychotics, such as olanzapine. This makes it a potentially safer option for managing psychotic symptoms in older adults. Managing psychotic symptoms effectively is one of quetiapine's strengths. Research shows that it can lead to significant improvements in symptom scores for patients with schizophrenia and other psychotic disorders over the long term. Dosage adjustments are often necessary for elderly patients. Lower doses can help minimize side effects while still providing therapeutic benefits. Regular monitoring of cognitive function, blood pressure, and overall health is essential to ensure that any potential side effects are managed effectively. When comparing quetiapine to other antipsychotics, it may offer a safer profile regarding metabolic disorders and cerebrovascular events. However, it is important to note that it may also have higher rates of falls, which should be taken into account when prescribing this medication. Understanding the long-term effects of quetiapine in elderly patients is vital for optimizing treatment strategies. While it can effectively manage psychotic symptoms, careful consideration of its side effects and interactions with other health conditions is necessary to ensure safe and effective treatment.